Calabar. So which I have said, I didn't know it because I was like, why will you go to Calabar of all places? I said all of them. But that why she believed was that like the witcher girl was like since in the house, she told them that they're going to Calabar. Because the same people and we just make
Guys, check your audio.
that so she now said that
Hello, good evening. I'm sure you can hear me. So
Good evening,
Yes,
Prof.
Prof.
Yes, sir.
Good
Good
evening,
evening, sir.
Prof.
Good evening.
Good
Good evening,
evening,
Prof.
Prof. Good evening. Hear you.
Welcome,
okay,
Prof.
good evening.
Good evening,
Yes.
Prof.
Okay. Let me
Good evening.
let me apologize for the disruptions in the scheduling of our lectures. I think a few lectures were missed, and while others were not taught the time they were scheduled. So let me apologize on behalf of the lecturers, affected lecturers. Our department, that is the Department of Preventive and Social Medicine in the university. No, it's in the hospital. Department of Community Medicine in the hospital. We have an accreditation visit. In fact, the accreditation team is already on ground. So Dr. Julie, who is the head of department, is hosting them about now. So that's why she couldn't give the lectures. So let me just apologize. But I understand that you have been given the lecture slides. In fact, she said you should visit those rehabilitation homes, and both the old people's home and the rest, and those correctional centers. Anyway, it's not that it will serve as continuous assessment. It can't. Mm? And it will not be used for continuous assessment. But you should if you have the opportunity, visit those places so that you have an idea of what it is. I'm sure that some of you may be wondering why the prisons, the name of the prisons in Nigeria has been changed to correctional centers. Okay, I don't know if you have ever wondered about that change of name. Is the fact that those that commit crime are supposed to be corrected, to enable them to corrected and reformed, to take them away from the life of crime. Okay, away from crime. So that is how it is not. It's no longer supposed to be punitive. Prison services in prisons serve as a punitive measure to punish people for their crime, whereas correctional centers are almost like character reforming institutions. Okay, so please, if you have the opportunity, you can visit. But let me just assure you that it will not be used as the continuous assessment. Okay, but you should read. You should read up. In fact, some people are complaining, or people are saying that we are spoon feeding you. That's at postgraduate level. You will be asked for each course, you are supposed to have a reading materials, books recommended, and that it should be the person doing most of the reading, and not have detailed lecture materials given to you. But that is our choice. That is our choice. Okay, especially because of our pattern, the way we teach. We are using what they call the flipped classroom. You are supposed to be given instructional materials, and then you read outside the real-time lecture, and then come to the lecture, and then ask questions. That's why we want, at regular intervals, we stop the lecture to give you opportunity to ask questions. Okay, so bear with us. This course will be ending today. In fact, I've had all the lectures. I've taught this one, this particular the lectures I'm going to give today. I've taught them to those in the MPH occupational medicine class. Okay, so but I need so today is just to make sure that those at the other stream of the program, they are also taught. Okay, so that is it. But that's not all. We have also shadowed the exams for next week. Already we are receiving complaints. Some because of the short notice. Some people would have preferred having a week to prepare for the exam. But the problem is, the problem in doing that is that it's going to prolong. It's going to prolong the program. We want the taught courses to be completed probably around January, February next year, so that other aspects we can start other aspects like the project, teaching a research methodology and then starting the project. So we cannot afford to give additional 1 week. In fact, from this point, instead of having lectures for 2 days, we'll be increasing it to 3 days. We'll be increasing it to 3 days. So you have lectures for 3 days. I think it even started with this course. So it will be lectures for 3 days. Okay. And okay. So we are entering. So for those that can't track the exam due to for any reason, please they shouldn't worry, and they will have the opportunity to write the exam at a later date. They'll have the opportunity to write the exam at a later date. So the exam will also be MCQs. Will also be MCQs, but we are also exploring a special type of MCQ, like in the environmental health course. We are we'll be exploring the use of pictures, what has been called picture tests. So for those in environmental health, we are going to do the MCQ, or the exam will include picture tests. I think we had a trial. We had a trial of that in the last lecture we had in that course. So it will involve showing you pictures and then asking you questions. Okay, although you will also be provided with options, just as in the standard MCQ question. The only difference is that you will be given more time. You'll be given more time because you have to look at the picture, understand it, and then answer the questions. Okay, so that is it. Okay, which other thing now? Okay, so after the exam next week, we are going to have another course, and it will be the first of the specialist courses. It will be the first of the specialist courses, and it will hold for 2 weeks. It will hold for 2 weeks. It will be the first of the specialist courses. So we'll be going into our separate courses. So each of you will start the course that is specific to your program. We start the course that is specific to your program. Those in MPH will have a lot of courses in common. Have a lot of courses in common with other programs, especially the health system management. They have at least 2 courses common to health system management. Then, in addition to 1 course in population and reproductive maternal and child health, and then later they will have a course in environmental health. Okay, So that is it. But that course, the next course after the exam will run for 2 weeks, because because we want the period of the scientific section to be completely lecture free. We want that 2 weeks plus period to be completely lecture free. Okay, so we are not going to have lectures between 15th September to 31st September. Sorry, 30th September. Okay, so this to enable us concentrate on the scientific conference. Let me thank those that have registered for the vote of confidence. Yes, because it's not difficult. It's very, very difficult to pay this extra money at this time. So we have to thank you for that. I don't know if there's any question or comment on what I have said before I go into the lecture proper. Any question? Any comment?
Good evening, Prof.
Avo, can you? No, best man, just hold on. You're supposed to raise your hand. Hello, Avo.
Yes, good evening, Prof. Please, please
Yeah.
confirm you can hear me.
Yes. Yes. I can hear
Okay,
you.
so on the is with respect to the conference, on the link that was provided by the admin for the registration, there's a part that says organization, the university School of
Sorry,
Postgraduate.
I didn't get that.
Hello?
I didn't get that.
I said so on the registration link for the conference, there's a part that says organization. Are we to put the university or we should put the our workplaces?
No. It's School of Public Health. School of Public Health.
Okay.
Yeah.
All right. Thank you very much.
Yes.
Yes, sir.
Okay. Hello, Tanko. Tanko Yunusa. Hello, Tanko.
Hello, sir.
Yes.
Good evening, Prof. Okay.
Good evening.
One of my questions has been answered. Then remaining one concerning the organizations that she just asked. Issue concerning payment of this conference. Sir, can one pay it at the end of this month, not as we enter
problem.
September?
No. Just as we said that we have assumed that all of you have paid. Okay. You have all paid. The thing there is that what we are going to do is that the proof of payment will be asked for. In fact, we are going to send you the details, and those links, the link has already been sent out. So the only thing is that at the end of the year, at the end of your program, when you are through, during your clearance, we'll ask for the proof of payment. Yes. So you can take your time.
Okay, sir.
Okay. Yeah. Hello, blessed man. Hello. Blessed man, I hope you know how to unmute.
Good evening,
Yes.
Prof.
Yes, good evening.
Please, it's just a suggestion I want to suggest about, since for this period of the conference, since it's going to be a lecture-free period, I want to suggest if the lecturers that will be coming after the conference can help us and drop their materials ahead of the time so that the students can be able to access them before the lecture commences.
Okay. That is actually what we'll expect each and every one of them to do. But at times, yes, in fact, you know that the school, although we are part of the University of Port Harcourt, but the lecturers are recruited separately. It's not part of their responsibilities. So each of our lecturers are given appointment letters, and these conditions are usually stated. perhaps we should be able to enforce it. Even this idea of shifting lectures is not, they are not supposed to do it, because the quality of programs, academic programs, there are various criteria for assessing that. I think one of it is the timeliness. Timeliness. In fact, yes, timeliness. And we don't want a situation where we will be scoring low in that aspect. So we will try. We will try. We will continue to try. We'll continue to try. Yeah. Hello, Eze. Yes. Eze.
Hello. Good evening, Prof.
Good evening.
Yeah, thank you so far for your wonderful support. I just want to know if this payment, because you said it can be traced back, because the conference one, it can be traced back when we will be graduating. Can it be put in our the LMS so that it can actually be in the system, so that we can actually pay there, and then whenever it's needed, it can be part of the school fees? Is this something that we can do there?
Okay, that is paid through the LMS.
Yes. So that in case you misplace your whatever proof, it can just be in the system and it won't be a problem then.
Okay. We will explore that. You know that if you pay online, there's a service charge. I don't know if you have noticed.
Okay. So thank you.
PNSA. Okay.
Yeah, sorry. So then, Prof, the second one, just a little one. I wouldn't know, it's just an appeal. I think I did join late a little bit when you were talking a little bit about the exam. I wouldn't say you should repeat yourself now. Do you mind maybe at the end of the lecture, if you've got a little more time, just to really throw more light on
Yeah,
what you
because I said that earlier, because perhaps those in because I'll be repeating the lecture I gave to those in the MPH class.
Okay, sir.
Okay, so but what we are saying that, of course, it will be MCQ, just as
sir.
you are used to. But in we taught environmental health to a section. Those that didn't do biostatistics, we taught them environmental health. And I was saying that for that course, they will be shown pictures. Yes, they will have the standard, the regular MCQs, but they will also have what we call the picture test, where they will be shown pictures and then asked follow-up questions. That is the only difference. In fact, we are also beginning to we are trying to incorporate it more, because public health has a lot of practical components. In fact, as you go into the community, you should be able to be identifying. You should identify hazardous conditions, things that are not right, and then begin to think of possible controls. For example, if you see a woman force feeding the child, yeah, you can be shown that picture, and then you can be asked what are the likely health effects, and so forth. So it's just a way the nature of that of the picture test, except that the only additional thing is that options will be provided, so that it can fit into the MCQ format. Okay, so that is basically what the exams are, or will be. And I also said that those that can't write now can write the exam later. Okay. Okay, so we can go to Barry. Hello, Barry.
Okay, sir.
Hello,
Good evening,
Barry.
sir. Good evening,
Good
Prof.
evening.
Okay, yeah, I just want to support what the second to the last speaker said, that if it is possible for us to have the payment for this scientific process on the LMS, it will be fantastic. The extra charges can be dealt.
Okay, it's not it's not significant.
Not
Okay,
really
so
much. I think
okay,
so that we have all our receipts piled up one place, and we are seeing the generated payment profile, and it will be nice.
Okay, okay. I will explore. We'll explore that option. We'll explore that option. Huh?
I'm sorry, Prof. I didn't get your answer to the lady's question where she said what should be put in the
No, we said
organizations.
We said
place where
if
there's organization.
this thing now, that is the School of Public Health.
Okay,
yes.
School of Public Health. Okay.
Yes.
Okay.
Thank
you, Prof.
Okay. Namet. I hope I got that.
Good evening, sir.
Good evening.
Sorry, please. I just wanted to ask concerning the lectures you said we are going to have after these exams. You said there will be a 2 weeks lecture after, before the conference. Are we going to write the exams of that lecture before the conference?
No, we will wait. The three specialist courses will be written together. Yes, there are 3 specialist courses. So we'll do one before the conference and then continue after the conference. We'll do the rest 2 after the conference, and then we'll write the exam. Okay, I don't know. Perhaps for the logistic reasons, perhaps we should just write the exam after the conference. Should it be like that? Okay. Anyway, we'll just look at the logistics. Okay. Hello, Olajumoke. Hello.
Yes, good evening. Good evening,
Yes.
Prof. Can you hear me, sir?
Yes, I can.
Okay, thank you very much, sir. Thank you for the opportunity. Just to remind you, there was a time we complained about the way the the answers during the exams were reshuffled. You promised to help us speak to Haiti about that. So this is just a reminder. Secondly, sir, like on the question you asked, that would we prefer the exam of the specialty before we go into I think that would be nice before we have the 2 other ones. Yeah.
Okay.
Thank you, sir.
Yeah, so that you don't have to write 3
Too much
exams
at a
in
time.
1 week.
Yes, sir.
In 1 week. Okay,
Thank you,
we'll
sir.
explore that. Anyway, this other one, we have to be more careful because the questions are reshuffled. And so if you ask leading questions, or like say make one question connected to the other, once you reshuffle it, it becomes a problem. So we will look into that, and that's why perhaps we will tell the lecturers to submit questions early enough so that we can vet them and ensure that such questions are not included. And then for the other one, now some people were complaining that there are more than 1 correct answers. Anyway, that is that is the difference between MCQ at the undergraduate level and of the postgraduate level, and it is said to be the best option. The best option, and not yes, the best option. Okay, Lavina. Hello, Lavina.
Yes, good evening, Prof.
Good evening.
Okay, thank you for all the explanation. Please, I just want to know if I will not be able to join the exam because of certain activities in my workplace. So,
yes. Go on.
So, do I write, or how do I?
No, don't worry. Don't worry. You will give it a pass. You just leave it at the end of the program, or we can, if sufficiently large number didn't write, we'll schedule it before. But usually we have a period at the end of the 3rd courses where we do the remedial program. Remedial program. In fact, in order to encourage people to write at the right time, we try to charge a token fee. Token fee. So if you if you are writing at during the remedial program, or during the second this thing, you'll be required to pay an additional a small money. It used to be 5,000 per course. Okay, so that is a full disclosure.
Okay.
Yes, remember that we are not that collecting that money is not because we want to generate revenue, but is to put pressure on people to make the extra effort to write as scheduled. But we don't want a situation where one or two courses will be what will hold somebody, what to prevent somebody from graduating. Because technically you are supposed to pass all your courses before your final defense. Okay, and these courses are held every year, every academic section. So if you mix one, technically you are supposed to wait till the next section. But we introduced that the remedial program. In fact, we had to even call it remedial program because our university doesn't allow receipts. It doesn't allow receipts. Okay, thank you all.
Okay.
Yes. So I can move on. Anyway, those of you in environment. Occupational medicine, MPH, they can listen, and then it will almost be like a recap. So we'll be discussing social marketing. We talked about risk communication. So today we'll be talking about social marketing and then advocacy. We'll end with advocacy. For social marketing, one thing that public health, we are designers. We design programs. So yes, we design programs. So if we identify a public health problem and we think that it is big enough to be controlled, what is expected of us as public health practitioner is to design a program to control that problem. So we design a program, puts a lot of things based on those principles we told you of, that public health is based on equity and social justice. Equity means that people, persons, or individuals in a community are given healthcare, not according to, not equally, but according to their needs. And that is what equity is. So, yes. So no matter, irrespective of being poor, if you are poor, you know, if people, those that are poor, they have higher health needs compared to the rich, who are even able to privately privately pay for health services. Okay, and we said the other one is the social justice. Social justice means that if you are poor, the rich should be able to assist the poor. The rich should be able to assist the poor, to assist in taking care of, ensuring that health services are made available to everyone. And that's why in government, that's why most governments or most countries adopt what they call the payee system, pay as you earn. So your taxes are not equal. It's not like in the village where, or even in, not in the village where people are taxed equally, whether you are rich or you are poor, you are taxed equally. In the government setup, you pay tax according to according to how much you earn. So the rich pay higher and the poor pay less. Okay, and even in providing those services, we have what they call the social insurance. Social insurance in which all the monies are provided and then used to take care of the health service of people. So in public health, we package programs, okay, but it's not enough to package program. The interest is to get members of the public to patronize that product, to patronize the services you are packaged. Okay, so how do you encourage them? How do you encourage them? You know, in public health, we have done away with forcing people. Done away with forcing people. For example, you know, compulsory vaccination. People kicked against it. So we have done away with, although it's somehow being used, but it's used at the last resort. So in public health, the tendency or what is being done is to encourage people to patronize the service, to encourage people to patronize the service. And in encouraging people, the public health practitioners are now using the methods used by the commercial companies, the commercial companies in marketing their products, the commercial companies in marketing their products. And what is being done, and that is what is called social marketing. Social marketing. So when we do it, when we market in public health, that's the objective of the market is not to make profit. It is not to make profit, but to encourage people, everybody, including the poor that have very little to even pay, to patronize the service. To patronize the service, especially as is said that in public health, the services you package is not good enough. It's not good enough if the poor cannot access it. It's not good enough if the poor cannot access it. So that is what social marketing is. Social marketing has been formally defined as the application of commercial marketing technologies in the analysis, planning, execution, and evaluation of programs and products designed to influence the voluntary behavior of the target audience in order to improve their personal welfare and that of the society. A long definition. In fact, we are not likely, even in the period we are using theory questions, you are not likely to have asked you to define social marketing. We don't do that. The most important thing is to understand what it is. Understanding something, a term, is better than regurgitating it. Rote learning is not good enough because you just know, you can define it. You can define it as you're preparing for the exam. Probably you just memorize it, but 1 or 2 weeks later, you have forgotten. You have forgotten it. So that's why the emphasis is to understand it. So I hope this summary or to put the definition in simple terms, it is basically, social marketing is basically the use of commercial marketing techniques in the promotion and distribution of health services and products, not for profit, but to achieve social goals. So social marketing is very, very important in the new practice of public health. Very, very important in the new practice of public health. Remember, we teach you professional competence. The ability, this social marketing is a very important skill to have as a public health practitioner, because it will enable you even practice as a private practitioner, and you'll be able to make something out of it. Okay, so what in social marketing, what is being marketed is not necessarily a tangible product. What we market in public health are not necessarily tangible products. Some of the things we market are intangible services, good behavior, like hygiene practices, like physical activity, like patronage of the health center. They are abstract. They are abstract. They are not physical products that we can touch, but we still have to market them. We still have to market them. But to market them, we have to precisely define them. We have to precisely define them. And that's why even in physical activity, physical activity is becoming very, very important. Remember what the WHO, that WHO study the global disease burden, which the WHO conducted worldwide in 2001, it found out that physical inactivity was responsible to a large number of diseases and a large number of deaths, including deaths from diabetes and hypertension and the rest. So that's why. So physical activity, to encourage people to be more physically active, we have to socially market it. And that's why that physical activity has been precisely defined. It is called physical activity. It's not called exercise, because it's physical is anything. What is physical activity is anything that can make you breathless, that can make your heart beat faster. And they didn't just end there. They said you have to do it for at least 30 minutes in a day, 30 minutes in a day, and then a total of 150 minutes, 30 minutes in a day for at least 5 days, or a total of 150 minutes in a week. Okay, so it is prescribed. It is precisely defined. So with this definition, you can actually see it in your mind's eye what physical activity is. Okay, what physical activity is. In fact, with the era of the smartwatches, you can actually count. The number of steps, and then that number has been placed at least say about 8,000, 6 to 8,000 steps a day for a lot of persons. So it means that, and that precise definition means they say it's a day, in a day. So if you are expected to take say 6,000 or 8,000 steps a day, your smartwatch can count it, such that at the end of the day, before you go to bed and you check your watch and you are still short, you can go ahead. You can just go on and make it up. So that is how the products are. That's how the products are. That's how the products are. So, but before you can sell something to somebody, you must know the person. You must know the person. You must know what moves the person. You must know what moves the person. What moves the person. Remember, we said, of course, at times you can use threats, you can use benefits. At times, we were saying that when it comes to threats, that a lot of times we use it in Nigeria, and we know what can frighten a Nigerian to take action. What can frighten a Nigerian to take action? We said for the males, if you say something about their potency, they sit up, they become interested. And then for women, if you say that something that is that can affect the ability to have children, they are also interested. And that's why those adverts you hear at road junctions, advertising herbal products, are actually on that, have those as their themes. So you have to understand the individual, their likes, their dislikes, when they like the services, when they like the services. If somebody is busy, is in paid employment, you don't expect, it may be difficult for the person to patronize the service if the services are provided only during working hours. You can't change it to make it probably evening hours, so that people can go to work and then come back and go to the health facility. And that's why in most private hospitals, in government hospitals, they run their clinics during the morning hours, but in private hospitals, they run their clinic in the evenings. And that's why a lot of people prefer going to a private clinic, because it is they run those clinics within the period that they can afford. Yes, when they can afford. Okay, so all those things you have to find out. You have to find out. Remember, we also talked about the different audience. So if you are creating a message, it's not just the person that will take the action that you can target the message. Yeah. At times you can even target what they call the secondary orders or the secondary, significant orders, or what they call the secondary audience. These are people that have control, or influence over that individual, people that the individual listens to. We talked about religious leaders, that they are such persons. They are such persons when they say one thing, their followers hears 2 times, literally. So, and of course, even for spouses, they have control over each other. Probably when they are in the inner room, when they're in the other room, the spouse can literally force the other person to take that preventive action. That action so you can target them. You can target them with the message. Okay? You can target them with the message. So we have to know that when we are designing these messages, it is not just the person, the people that need to take action. Other times we can take the indirect route by looking at those those that have influence on them. Then we have to also look at even how the message should be communicated. Who should communicate the message? We talked about young persons. They like messages delivered by either their peers or by the so-called celebrities. That's why you have endorsement deals, companies, and a lot of others. They engage in they have brand ambassadors. Brand ambassadors. These are for those of the young age, and so forth, experts and this thing. So yes, but in social marketing, they package our product using the 4 P's. They package our products using the 4 P's. The first P is product. The second P is the price. The third P is the promotion. The fourth P is the place. All these things are the product or the service you want to market are packaged to make them compelling. They are packaged to make them compelling. So we are going to take these 4 P's of social marketing one after the other, starting with the product. The product, you have to make the product very, very attractive, irresistible. You have to make them very attractive, yes, and make them compelling. How do you make a product compelling? The first one is the relative advantage. So make it better. Make it obviously better than what you want to replace it with. For example, insecticide treated bed nets was used to replace the untreated bed nets. So that insecticide in it kills the mosquitoes, and it's such that even if they have holes in them, mosquitoes find it difficult to pass through those holes because of the insecticide in them. So that relative advantage you must mention. That relative advantage is more mentioned. The other one is compatibility. How does the product fit well with the intended audience? If somebody is busy, how do you make him or her to adopt the healthy behavior? How do you make him or her to adopt the relative behavior? For example, that physical activity, they said 30 minutes of moderate to intense physical activity in a day. They said it doesn't mean that you have to do it for 30 minutes at a stretch. They can add up. They can add up. So which means that no matter how busy you are, you can fit in the required level, the required amount of physical activity. Once in a while, you can stretch, you can jog, you can move around. You can move around, and all of them count. All of them count, and counting, especially if you have a smart watch. So you have to. So compatibility. So no matter what, and we also talked about the timing of services. If somebody is paid work, they rush out in the morning, but they come back home in the evening. So what prevents you from providing the services during the evening period? So compatibility must look at that. They said the other one is complexity. You have to make the use of the product easy. You have to make the use of the product easy. If you have ever bought ancestral treated bed nets, you will see that everything you need to hang the nets are provided. Everything you need are provided. The hooks, the nails, etc. They are all even the threads to tie the nets. They are all provided, so you don't have any problem. And then drugs are increasingly being converted to single dose treatment, like SP, the drug used to prevent or even at times treat malaria. They are single dose. And even for treatment of STI, single dose. So once you catch the person, once the person comes to the hospital, you give him the injection or watch him take the drug, so that you are sure that he has been cured, even if he forgets to take his the other doses. So complexity you have to consider. The other one is triability. You have to give the person the opportunity to try the products. Give the person the opportunity to try the products. Okay. So even if, for example, a toilet, if you are encouraging, you want to encourage members of the community to own their own toilets, own their own toilets. So you can actually, you have to give that the person the opportunity to just try the toilet. And the best way to do it is to put the toilet in a public place, the health center, the town square, motor parks, so that they can try it and hopefully they will enjoy it. And with that, they will be able to provide that for their household. Triability. Remember that even for brand new cars, even Tokumbo, even if it is Nigerian use, they will let you drive the car. They will let you drive the car to make your own judgment. So triability is always there, should always be there. Then observability. You're the person. You have to package the product in such a way that they can observe the difference, the advantage it provides. Inside treated bed nets, you can actually, when you hang it, you can actually see the dead mosquitoes. You can actually see the dead mosquitoes. So you can tell them to observe it. To observe it. To look for it. Okay? To look for it. And then physical activity, you can, or you find physical activity, you can, a person can feel the effect, increased stamina, and so forth. And then, but we must also, when you are communicating, you should be able to use advantages that can easily be observed. Don't look for advantages that will manifest after so many years. No, use for small ones. If you can, it's not good enough if you are advertising a cigarette cessation, for you to start to talk about preventing untimely deaths, because it takes a long time. And the patient or the person you are preaching to may even point to someone that smoked all through his life, but he is in his 80s. So that will not convince him. Instead, talk about the smell, that smell. Talk about the heartbeat and so forth. Okay, observability. Okay, the other one is to brand it so that people know. People know that the person is doing something good, something admirable. You brand it. You brand it. Okay. Okay. So we have talked about the product, packaging the product, making it compelling. The other one is the price. And in this case now, in social marketing, the price is not just money. The price can be convenience. The price can be reduction in travel time. Yes, reduction in travel time. Okay, like one-stop shop. One-stop shop. People are being encouraged to go for regular medical checkups. The way it is in the usual tertiary hospitals in Nigeria is that the services are provided all in multiple departments, such that if you want to carry out the required medical checkup, you may even visit more than 5 different departments of the hospital. So the convenient, and that's it is more convenient to do a one-stop shop, and that one-stop shop will be able to solve the problem. So the price, there is when people price, there is always a trade-off. Remember what we talked about, the health belief model, that when someone is considering to make a change, is considering to change from one behavior to the other, he does what calls benefit analysis. It does a cost benefit analysis, and that is what you should do in packaging, in considering the price. What is the advantage? What is the advantage of that particular healthy behavior, and what are the disadvantages? Are the advantages significantly higher than the disadvantages? You have to talk about. Look at, for example, in Nigeria, if you are a little bit obese, people will see you as affluent. People will see you as affluent. But if you are slim, they may think that you're a hungry man. So if you are telling somebody to lose weight, you have to consider that also. You have to consider that also. You have to consider that also. So if someone is a bouncer, earns a living by being a bouncer, it may not, you have to convince him, you have to convince him to, you have to convince him how weight loss will benefit the person. It shouldn't be like that of, that's the girl who's the demon in her was cast out by Paul, and the people that were using her to make money got angry because that led to the loss of their source of livelihood. So that cost benefit analysis should always be there. Then the other one is the place. Where do we provide the service? We said we have talked about the certain services are best provided in the workplace. If you want the workers, if you want it to be compulsory, you take it to the workplace. Or to the school. All those depending on the population. For example, you want your children to be vaccinated. You can make it a policy in the school that every child, before he or she is registered, must have a complete immunization certificate. Okay, immunization certificate. So it's better that way. You look at the place. And even for services, you can take the service to as close as possible to where people live and where people work. This is even included in the definition of the primary health care, taking health services to as close as possible to where people work and where people reside. Okay. Okay. So we have also talked about that one-stop shop, and we have also talked about the timing. The timing. It has to be convenient to the person. It has to be convenient. Then the other one is the promotion. How do you promote it? How do you promote it? How do you promote it? The good thing is that we have social media, so the adverts are cheaper. The adverts of social media are cheaper. Just create the video and then and share it. Create the video and share it, and it may even go viral. So it goes viral with little amounts money spent. It can go viral with little amount spent. You know, we're also talking about who will say it for you, the communicator, and so forth. Okay, these are the 4 P's of social marketing. 4 P's of social marketing: the product, the price, the place, the placement, and then the promotion. All the 4 P's of social marketing. Let's just quickly take the additional ones. These additional ones are also added. The first one is the policy. If they work, if you know, we talked about global public health good. It benefits the person that uses it, but also benefits others. So because of that, one can easily get subsidy because it's a government policy. For example, the Nigerian government makes preventive services either free of charge or highly subsidized. Okay, and they give NGOs, they give NGOs providing those services little or no money. Sorry, they don't tax them. Okay, they don't tax them. So because of that, they are able to their products can be cheaper, and cheaper products are more affordable to more persons in the community. Then more persons in the community. Then the other one is the partnership. As much as possible, it is better. It is very good to partner, especially with religious bodies, because they have a strong hold on their adherents. So it is better we partner with them. And when we partner with them, we are likely to have a lot of success. Other questions or comments? Hello, Patience? Hello, Patience, you have a question? Questions, comments? Or no question? Okay. Okay. So we can go to yes. Are you?
Hello, sir. Sorry, I've been wanting to ask you a question when you were discussing about the conference, but I was muted, so I couldn't ask. It's just now at the class if I can still ask my question, sir.
Go on.
Okay, sir. Concerning the conference, the link that was sent to us this morning, I discovered that the meeting there is 9 a.m. and it is starting on the 15th of September, and that is the same time NSM2 is starting their own, and the two is clashing. So I don't know if I can forfeit it. Then maybe join after the NSM conference.
No problem now. No problem. I hope the public health nutrition day doesn't clash with that. Does it?
No, sir. It's after the conference.
Okay, that is good. That is good. So we don't need to change.
Thank you, sir.
Yeah.
Thank
a
you,
Messi.
Sir.
Yes, a Messi gift. Hello, Messi.
Okay, good evening, Prof.
Good evening.
Okay, sir. Mine is contribution and also want to ask a question.
Okay.
Okay, sir. Sorry, I want to take you back. The question I want to ask is not regarding the topic we treated today, but the previous topic. I don't know if I can go on. Okay, first,
go on.
I want to believe that environment influences people when it comes to smoking. like Russia. Russia is very cold. So most people in such countries, at times you see them smoke, it's not because they really want to smoke, but because of the environment. That is the climate. Then secondly, my question is on alcohol. Sir, please, I want to know, does alcohol consumption during pregnancy, does it have any significant negative effects on a developing fetus brain? Because I've noticed something in my vicinity, some pregnant women, when they are pregnant, you see them taking alcohol, and when you caution them about it, they tell you that it's pregnancy crave. And after giving birth, for some that I've studied, I discovered that these children, they are having behavioral issues like conduct disorder. They're not behaving normal. So I don't know if alcohol has effect on
No, it does. It does. That is what they call the fetal alcohol syndrome. Fetal alcohol syndrome. So that is the effects. And in fact, and it's also becoming more important in developed countries where they have conquered, where they have prevented maternal death. The emphasis is now on having quality children. Quality children. So, and in Nigeria, it's getting to that. So people are no longer interested in quantity, but they're interested in quality, because competitions are fierce now. So it doesn't make economic sense to train a child that that doesn't have, the brain is not sharp. I put it. So all children should be like Nazarenes. If we are Christians, in the Bible, when the Bible people, when they want to have special children, they abstain from alcohol. They abstain from alcohol. Special children. Special children, and that is what we should aim at. So it affects the brain of a child, and reduces the IQ, which is a very big loss. Not only to the family, but to the country. To the country. So it's in fact, it's such that even alcoholic beverages, some people are putting health signs that shouldn't be drunk by pregnant women. Okay. So that craving shouldn't arise. Okay. Hello, Anne. Anne. Hello, Anne.
Good evening, sir.
Good evening.
Yeah. Sir, please, mine is a concern and a kind request. It's about our upcoming exam. If we can actually have our exam extended by 1 more week, so we can actually have next week to actually prepare for the exams.
Yes.
I'll be so glad
okay.
if you can actually.
I'm sure you joined late after I've addressed it. It has to do with the disruptions. The last one we had that extension, we are still managing. You'll notice that we have increased the number of days of lectures from 2 to 3. So we don't want to have these things concluded, the third courses to be concluded within latest January, February next year, so that we can dedicate the rest of the months to doing our projects. And we also gave this option that if you feel you're not ready, you can just skip it. You can even decide to take one out of the 2. But you have to write it during the remedial. So we have given you such options. Okay, so that is it. And so let's just try. Augustina.
It's okay. Because we actually had some lag during our biostatistics, and that actually affected me.
Don't worry.
So
don't worry.
that's why I'm also like asking, making this request.
Biostatistics is like you don't read a lot in biostatistics. When you know how to calculate it, you just know how to calculate it. But don't worry. Don't worry. Augustina. Augustina. Hello. Augustina. You are muted. You are not muted. Your mic is open. But can you say something so I can hear? If you can't, then we'll go to Ijoma Elekwachi.
Good evening, Prof. Good evening, everyone.
Yes, good evening.
Okay, Prof, please, I have two questions. First one is regarding the just concluded topic. I didn't understand the comparison we are trying to make insecticide-treated net that have holes.
No, yeah, I was just saying, when you are marketing a program, when you are packaging a product or service, you must show that it is better than the existing products. So I was just saying, I was just hyping the insecticide-treated bed net, that even if it has holes, the mosquitoes will still find it difficult to pass through those holes because of the insecticide, in them.
Yes, sir.
Okay, so that is it. That is the explanation. Yeah.
Okay, Prof. Please, one more question, if you don't mind, sir.
Okay, go on.
It will be taking us back a little. It's about your lecture on fasting, and I know it's a bit late, but I've been trying to understand it. So fasting, you were saying that time you were telling us that when the body is deprived of glucose for a long time, we are teaching the body cells to start eating themselves. I don't know if you remember the comment. Yes, and then the consequence of that, of prolonged fasting, basically.
Okay, okay. There are various different types,
Yes, sir.
There are different types. Yes. If you fast, that one, the one they say is the Daniel's fast, the Daniel fast, it was just taking low calorie food.
Yes, sir.
It supplies the body with fluid and minerals and vitamins.
Okay, local food.
Very little.
That's for local
calories.
Food. Okay.
Yes, calories. Energy giving food, like what they call the macronutrients.
Okay.
So, so with that, the body learns how to repair itself. The body learns how to repair itself. And this ability to repair is very good in the prevention of cancer and the prevention of aging.
Okay.
In the prevention of aging. Yes, aging actually stems from digestion of food and all those things, because they create oxidants. And oxidants are little fires that burn things within the cell. Okay, so that is that. Yes, but if you fast, the one Nipora or the one they call dry fasting, you'll be forced to begin to eat yourself, cannibalize yourselves.
Okay.
To keep going. That's why we lose that. Yes, to keep going. So, and that process generates a lot of waste. Generates a lot of waste, and that can be dangerous, Okay. So dry fasting is not good.
Okay.
But the ones that you take food, but very little, that one is better.
Okay. Thank you so much, Prof.
Okay.
Thank you.
Yes. Mohammed Ibrahim Abubakar. Hello, Mohammed Abubakar Ibrahim. Okay. Probably not responding.
Hello.
Hello, call. Okay. Yes.
Hello.
Go on.
Can you hear me, Prof? Prof,
Yes.
I have two concerns. One of the
Okay.
concerns is that of that form for annual conference. The space provided for organization, I filled my primary organization and submitted. So what
No
would be my
problem. No
first?
problem.
Okay. Secondly,
No problem.
Prof. Okay, sir. Secondly, Prof, I have interest on risk communication, and unfortunately for me, I missed that lecture. I don't know whether you can say something on risk communication so that I can be on the same page with my
Okay.
colleagues. Thank you, sir. Thank you.
I just hope that the lectures are still being recorded. Probably have to
Yes,
check
sir.
it out. But it
It's
has
all
to
right,
do with, yes, you know, at times the risk, the way the public see the risk is different from the expert opinion. So the risk communication is to see how you can manage the public view of the risk. Eh? Being able to control their responses, almost like remote control them. You know, that's why government is interested in what we hear in the information space, what we hear, so they can actually manipulate us, decide how we behave. Okay, so that is how. But you can look it up. Oga Ibrahim Mohammed. Hello, Collins. Hello, Collins.
Yeah, Prof. Good evening,
Yes.
sir.
Good evening.
Yeah, it's a privilege to speak with you since we started this program.
Yeah.
Hello, Prof. Please, there is a question that has been bothering me. Can people with comorbidity like diabetes and hypertension engage in intermediate fasting? Then, secondly, the previous speaker has said something about pregnant women taking alcohol, and when they give birth, the children doesn't behave normal. But I will also say that I've seen, I think we can also correlate it with the environment where those people are being raised, because I've seen people like children of the rich, their mother took too much alcohol, smokable, and these children are very smart. So I don't know if, I don't know the way you're going to explain it to us, because I don't think we can conclude that though is a factor, but I think environment also play another factor. Thank you, Prof.
If they are smart, they would have been smarter. They would have been smarter. So it's a waste. In fact, in developed countries, it's almost like a crime. If they see any pregnant woman taking alcohol, that woman will have to answer it. We have to answer. And then I guess that you are also a Christian. You just read about the Nazarenes. The most I think the best known is the best known is Samson. You know, when they want to have special children, they don't take alcohol, and they do that for a reason. Okay, so if you saw them smart, you know that they would have been smarter. The other one you talked about, the other one, how did I even forget? I don't know if you want to remind me. I know. Okay. I think it seems you have even forgotten. Hello, Selena. Hello, Selena.
Yes, good evening, Prof.
Yeah, good evening.
Yes, okay. Sorry, my network was actually dwindling when you were explaining the 4 Ps of social marketing. Please, I'd like you to just go over it again, please. Thank you, sir.
It's almost like the whole lecture. You said you have to package the product or service in a compelling way, and to do that, you have to look at the 4 Ps. 4 Ps plus 2. The first one is the product, make it compelling and attractive. The second one is the price. The price is not just money, it can be convenience. It can be convenience. The third one is the placement. Where do you provide the services? As much as possible, you take the service to where it is needed, Remember what Society for Family Health did with condoms. They made sure that you could find condom wherever you need it. So the neighborhood kiosks, condoms became available even in neighborhood kiosks, not just in pharmacy, but in the so-called provision store, so that people can easily buy and use them. The other one, the fourth P is the promotion. How do you promote it? You have to bring the product or service to the attention of the public in a way that will convince them to take action. We talked about significant others, those that exert a lot of influence. Religious leaders, etc. Okay. Those are so that is it. I think the other one is a policy. Preventive programs, preventive services are usually subsidized by governments or given tax waivers. So which means that they can be provided at cheaper price. And then the partnership, as much as possible, try to partner with religious bodies because they have control over a lot of persons. David, I think that will be the last for this section. David, you can go ahead and ask a question.
Okay. Good evening, Prof. Thank you once again for a very interesting lecture. Can you hear me?
Yes.
Okay, sir. And please, just a clarification from the definition of social marketing. It's meant to be non-profit. But then you'll find out that in a lot of situations, like the example you gave just now, with regards to the condoms, you have, yes, influence, behaviors are being influenced, but then also profit is also being made in a lot of instances. And it cuts across also for nutritional, like the nutritional sector and other sectors. In those kind of situations, is that how do we term that? Is that still social marketing, or because it's kind of like it's kind of like an overlap between social marketing and the regular commercial marketing?
Okay. Okay. Anyway, you said profits, but what is common is that the products are usually often sold at below cost, below the production costs. But that production cost, that subsidy would have been provided by government, probably through tax waivers. It can also be provided by funders, donor funds. For example, what Society for Family Health was able to provide condoms and essential treated bed nets and other contraceptives at very cheap price because they received a lot of funding from USAID. USAID. Okay. And to also tell you the truth that it has been found that it is better for persons to pay. When you pay for something, you appreciate it more and you are more likely to use it than if it is given free of, if it is given to you free of charge. And that's why there is right now there is a movement from free service to highly subsidized services driven by social marketing, because social marketing will convince you. Social marketing will convince you to buy, or patronize the service. So that is it. Thank you very much. The last one is the advocacy. Advocacy is how to get somebody to act, how to persuade. The art of persuasion is called advocacy. So in social programs, in public health programs, there's a tendency for us to, the resources are usually on the low side. are usually lower than we need, less than we need. So how do you generate the extra funds to provide these services? Okay. Or how do you, if you want to pass a new law or a new policy influence the government, how do you go about it? How do you go about it? Okay, so it's called advocacy. Advocacy, lobbying, can even be called marketing. But they are all designed, they're all aimed at making somebody do something. Making somebody do something. Making somebody do something by presenting the information in the way that moves the person. By presenting the information the way that moves the person. So if somebody has, assuming that you are interested in the health problem of a community and you want to solve it, and you have conducted your research and found the problem, how to communicate it, you communicate it differently to the different stakeholders in the community by noting their influence, their interests, their primary interests, what moves them to action. What moves them to action, you have to identify. What moves them to action, you have to identify. Yes, you have to identify. So you have to identify. So some persons you would like to be respected, openly respected. So if you are in their presence, you can. If you can show the maximum respect, if possible, tremble before them, dobale, greet them, praise them, praise them. And in the Niger Delta and a lot of the South, when you visit, when you are visiting, you come with a gift, and and the gift is usually a drink. Get a good drink, and then put a small amount, small money in the envelope to wage it. So that is how to go and visit them. And when you do that, they will feel appreciated, and then they will be able to do something. Okay. So, and we are talking about communicating these messages for politicians. If you are talking about, if you want to convince a politician, tell him about the possibility of election victory. Tell him about the possibility of election victory. That is assuming we are in a country where voters, the vote counts. Yes, assuming. So that the interest may not be to go and rig, but if the interest is to win the election from validly cast votes, then that will move the politician. Then if you are talking about religion, to religious leaders, you have to go scriptural. Tell them, put the Bible or the Quran, and they'll be moved. And when you are also talking, if you are talking about to a rich person, the rich person may say he may not use the services, because the services you are providing may be of the lower quality. Tell him about the child that his other loved ones may need it, may need those services. His loved ones may need those services, and then that he may even need those services in an emergency. In an emergency. So if a big man is visiting his hometown, if there is any problem, like snake bites, if he went to his farm and was bitten by a snake, the best in a country without an emergency, a proper emergency health service, it means that the best place to save his life would have been at the health center, the close by health center. So you can paint that scenario to him. You can reveal that scenario to him, and that may force him to act. Then the other one is that if they act, if they provide the money, please acknowledge that. Please acknowledge that. Acknowledge that openly. Even if the adverts, even if it means taking a full page advert in a national daily, if you are given a large sum of money, you can take a percentage of it and then do the acknowledgement. Give him an award. Give him an award, and he will come back. He will come back and give you more. At times, you can even talk to the antagonists. The antagonists. You can talk to them and tell them that, and yes, you can to dispel their fears. Dispel their fear. You are not there to compete, but to serve. That you can even collaborate, and that is how it has been. That's why it has been possible for the health workers to even work with TBAs. Work with TBAs, encouraging TBAs to recognize danger signs and then and to refer promptly, So you have to also look at those antagonists. Okay, so for of course multi-sectoral. If you are in a community, there are other government officials like in education. You can provide, when health education started in Nigeria, it was the health workers that were going to the health facilities to teach. It was the health workers that were going to the health facilities to teach. You can continue with that. You can continue with that. Okay. Then, yes, you can continue with that. Okay. Then for the government, you can also do something. You can also do something. Praise them if they provide, and then find a way to get them, bring the condition of the facility to their attention. I know that at times they may not, the government official may become intolerant. But it is always better to discreetly contact an NGO, discreetly contact an NGO to speak on one's behalf. Then from the private businesses, there is what they call the corporate social responsibility. Corporate social responsibility. Yes, a company is expected to do something for the host community, and whatever they do is tax deductible, which means that the company can literally use part of his tax to pay to do something for his host community, and that is good because it gives them a good image. So that's corporate social responsibility. You can actually convince the company, the private businesses to do that, to do that for health, to do that for health, to do that by investing in the healthcare of the people. Okay. For philanthropists, philanthropic organizations and philanthropists like Bill Gates, it is better for you to identify. It's better for you to identify where their interests are, and then package something along that line. So you cannot be talking about holding a religious crusade and expecting Bill Gates to fund it. So you have to first of all identify their areas of interest. And then you can work with, remember the public health good, the global public health good. So international organizations and countries, they are interested in funding those things. So if it has to do with contraception, if it has to do with disease control, that's disease control of infectious diseases. They are often interested. HIV/AIDS, HIV/TB, they are all interested. And then, yes, they are all interested. For religious leaders, you have to work with them to solve their problems. Some religious leaders, some religious organizations, they have peculiar problems. For those in Seventh-day Adventists and others that abstain from a lot of food, if you abstain from a lot of food, it restricts the number of food you eat. And that restriction can lead to malnutrition. That restriction can lead to malnutrition. So they are always willing to assist in identifying healthy foods, So yes, in identifying healthy foods. And organizations like Jehovah Witness that have problems with that don't accept blood transfusion. They don't accept blood transfusion. They are actively funding. They are actively funding bloodless surgeries. So we have to do that. We have to work with them to provide those services, the services that suit their members. Okay, so I've quickly gone through advocacy and how to basically, with emphasis on how to raise resources from within members of the community. I don't know if there are questions or comments. Questions, comments? Questions, comments?
Yeah. Good evening, Prof.
Yes. Good evening.
Yeah. Yeah, Barry. Yeah.
Yeah, I know.
Okay. Thank you for the lecture. It's been going smoothly. My question is for under the lobbying advocacy. You made mention of some religious bodies like 7 Days Adventist and Jehovah's Witness. I'm concerned because judging from your last statement, you said we have to work with them to provide services that suit them. Services that suit them. I'm concerned with the Jehovah's Witness because I during my internship in River State Investigation Hospital, I witnessed one issue with them. One the patient relative refused that the transfuse, and the patient, in a nutshell, the patient died. Should we, in those kind of cases where is the risk is already outweighing the benefit, just because it's a belief, is there no advocacy? Is there no advocacy procedure or protocol where we can, try to convince these people, especially they are already saying that this is not, there are no other ways, and this is not outrightly wrong. So are there no public health protocol that can,
I
somehow
think they are putting a lot of pressure on them, but they will tell you that it is one of almost like the cornerstone of their religious belief. So that's why they are also actively trying to prevent such. Remember the Lord's Prayer, lead us not into temptation. So they are also actively looking to prevent the situation. So, and yeah, so okay, so they were okay. So I hope I hello, Augustina. Hello. Augustina, I can't hear you. Okay, so hello, BC. Hello, BC.
Thank you, Prof. Greetings, sir. Mine is a form of contribution to this lecture, especially just to reiterate the importance of advocacy at helping you to achieve, your goal. From a personal experience, there was a time during the time of the ND. In the communities that were selected, they call it Millennium Villages Project. Select about 8 different communities with mortality as about 30% within these 8 communities because high attendance. So many of them are dying. Unfortunately, there was also a misconception on the fact that some of the mothers that die, they are either possessed or they are, they have injuries and different kind of things. So when we got there, we were able to, through the gatekeepers and the meetings that we had with the TBAs, eventually, we even at some point we told them that, okay, you can collect whatever you want to collect from them. Just make sure you bring these women to the hospitals. Brought them, you even see some of them while they have brought their patients, in quotes, now doing incantation and the like. So with this advocacy that we're able to convince them to bring these mothers to these facilities for institutional deliveries, we're able to reduce maternal mortality in those communities consistently for like 3 years to 0%. To 0% because we were able to do that because there's also the system in place whereby when there's a referral hospital that there has been an arrangement with where they can take the delivery of these babies, though the cost was actually very much because there was a total 100% free care in terms of this. So if we are able to, get such support, especially at our primary healthcare level, way more things, especially the health sector. And that's why I'm also happy with the who is focusing so much attention on the primary healthcare system. Thank you very much.
Okay. Thank you, BC. Hello, David. Hello, David.
Good evening, sir.
Good evening.
Okay. And thank you once again for the opportunity. Okay, so it's concerning the lobbying. I remember some years, some time ago, it was a foreign country where someone was prosecuted, an influential person in the government was prosecuted because gifts were given by the lobbyists, and when the government found out, when they investigated and found out that in the process of the lobbyists trying to get something, they presented gifts to him. So I just wanted to find out, get clarification on that, the issues, the ethical issues surrounding that, giving of gifts by the lobbyists to an influential person, and also in appreciation, will it be right as lobbyists to also appreciate with material things, be it money or any
Yeah. I think it has to do with it's cultural. In some places they applaud it. But you know that in America they say it's almost like it's an industry. It's an industry to go and lobby the government, and they do that. They do that with a lot of things. By eye service, by a lot of other things. Like, yes, there are a lot of other things. But in Nigeria, you can't succeed without parting with something at that level, at the government, at the level of government. You must be able to do something, even if it is buying hamper during festive period, making contributions during child dedication, weddings, and a lot of things. So they will have to find a way to give something. They have to find a way to give something. Then in the traditional, in what the community entry process, if you are going to any community, you are visiting the chief, you will go with something. You will go with what he said is just a token, a token. So even if you present a drink, it doesn't mean that they may not even give you a drink that is even much better than the one you have presented them. But it's just a sign, and it's also cultural. Okay, so just as we said that the objective of lobbying or advocacy is to convince people to take action, and people have a way. There are people who have certain things that move them. For example, Trump wants to be praised, wants to be praised. So if you just go and praise him, even if he's doing the wrong thing, even it was said that is it Secretary General of NATO was even calling him daddy. Was even calling him daddy. So yeah. So, and of course, the person that went a Belit grant, like what is it called? The Ukrainian president was given a wash down. So people have it. And in Nigeria, material things are there. In fact, in Nigeria, you may not even get anything done without having something for the person taking the decision. Okay, so yes, and of course you know that Benjamin Netanyahu of the Israeli Prime Minister is facing corruption charges, not because of money he received, but for the gift, undeclared gift, the gift he received as a prime minister, which he didn't declare. So it depends, and then of course, even Donald Trump organizing charity events and selling products. So different is cultural, and you have to act according to the culture and even the laws of the land. Okay, Collins.
Yeah, thank you, sir. My second question was not answered, but I was muted. Trying to unmute myself, I was unable to.
Okay, so just remind me.
I'm talking of people with a comorbidity like diabetes and hypertension.
Yeah.
Can they engage in intermittent fasting?
Yeah, they are called they are metabolic problems. They are metabolic diseases. They are metabolic diseases, and a lot of the problems associated with them can actually be corrected. Can actually be corrected depending on the type. Like even diabetes, the diabetes is not completely. They are not exactly the same. They are the disease is diabetes. They are diabetes. They may have diabetes, but they may have different types. Not necessarily type 1 or type 2, but there are some diabetes that is a problem of blood sugar regulation. The liver pumping in glucose when it shouldn't. What they call the fasting hyperglycemia. That one, even during the morning period when the person hasn't eaten overnight, the blood sugar remains high because of the liver pumping on. And that one, interestingly, can be controlled with some things that are different from the regular. So fasting does that. And diabetes also is associated with a lot of oxidative stress. A lot of oxidants are produced. So it is better if the body is trained to have that good responses. Have that ability to repair itself. Okay, but I'm sure that some people will say, that the body requires the blood sugar to be at a certain level, But just as we said, that it is not dry fast, but probably to reduce the calorie content of the food. So it may be that you may be sipping a fluid or something that will constantly boost your sugar level if you're a diabetic patient, and then it will be right. Okay. So the answer, the short answer is that it is acceptable. It's acceptable. Yeah. Thank you very much. I think with that we've come to the end of the lectures. So the next is the exam. We said the exam will be coming up next week. So 2 exams, one on Tuesday, the other one on Thursday. The first one will be biostatistics. So you have between now and Tuesday to revise. You have between now and Tuesday to revise. Please, you shouldn't be, yeah, there are certain things. Biostatistics is if you know how to calculate, if you know how to calculate it, just like in mathematics, no problem. You won't have any problem. And of course, the principles behind, because it is MCQ. So if you are giving the MCQ, you will not be required to do a lot of calculation. Yes, it's almost like the one they call mental calculation in primary school. I don't know if you did that, where they will ask you and you are expected to answer without writing the question down. I think I had MCQs, past questions being mentioned. I don't know if I got it right, but perhaps we should be able to look for about 10 questions and make that available for you to just have an idea of the kind of MCQs you should expect in the biostatistics exam. Okay. What else? What else do I need to say? You can decide to opt out. Can decide to opt out if you have any reason. But just know that if you may have to pay something for you to write the exam. So if you can manage, please write the exam and forget about it. But if not, you can write it later. Okay. And so once again, let me continue to encourage you to register for the conference, even if it's clashing with another conference. It's over a period of 13 days. And most conferences don't last that long. They are shorter, significantly shorter. 2 days, 3 days. And then the next day will be the rest will be filled with sightseeing activities. So you will always have time. You should have time. You should find time to attend probably about at least 50% of the program. You will enjoy it. They will also be recorded, and materials will be given, but most of them will be electronic. So don't expect a lot of hard copies. Although we are making arrangement for a jotter and a pen, but we cannot possibly send it to you. So if anybody that is anytime you come to come to the program, come to school, come to see us, you just get your own jotter and a pen, branded, of course. Okay, so thank you very much. Cyril Wale, you want to give us a closing remark as you did the other day? You can go on. Hello, Cyril.
Yes, sir. Thank you very much, sir, for your lecture. So it's still a reminder. You say, I think if I remember the last time, you say we should keep on reminding you with respect to as the conference is coming and the CME points.
Okay, CME. CME. So which one are you? Is it NDCN?
Yes, sir.
Or which one? Okay, it's NDCN points.
Yes, sir.
We'll go and meet NMA or the teaching hospital to let us have their have that. Hmm?
Okay, sir.
But it's not a problem.
Okay. Thank you, sir.
Okay. Thank you very much. And then have the best of the rest of the evening. Thank you. Thank you very much. Thank you.
Thank you, Prof. Thank you, sir.
Thank you, Prof.
Okay, thank you, sir.
Thank you.
Thank you,
Good night.
Prof, for
Thank
taking
you.
us
Thank
through
you, Prof.
this
Good
course.
night, sir.
Good night.
Thank you a lot,
Thank
Prof.
you, sir.
Thank
Good
you.
time.
All right.
Good night, sir.
Thank you, Prof.
Oh, she.
Good night, Prof.
Thank
you, Prof.
Our Prof of life. Thank you, sir.
God bless the Prof. Thank you, sir.
With the exam.
Prof. When you come now, when I was the CHO, coordinator, we were pampering those supervisors. So those that are going, community health, you are going to enjoy your. Mungo the Prof.
Mungo.
Sir,
You already aware of where they are going now.
Yes, so a lot of enjoyment now.
Yes.
I was the coordinator. We had to contribute money to be feeding. Who was shouting on the road?
Yes,
To be feeding.
Yes, with tickets.
Yes, so
some of them change weight.
That's Akwe Kaza.
Akwe Kaza. Within the short period, they'll change weight.
They are. Akwe Kaza.
Prof.
Yeah.
Community health students, what are we going to do?
Are you not going to enjoy? No, if you are not going for the exam, you can write the exam. If you are not going for national,
it's better now.
We are
Some
going
they
for
are going.
national.
Depends on where you're going to. Some are going to suffer.
no, which one? Which one? If you are going to suffer, you will be a weekend supervisor now.
Don't follow. Shelter, what's the problem?
You think I don't know that?
You know everything, sir.
You know that I was the coordinator. I was the CHO coordinator. When
you have finished everything now.
Mm-hmm. So
Yes.
the other people they were telling me what we had to do. The first
Yes,
exam we
it
did.
depends, oh, it
The first
depends
exam
on
we
the
did, the
ability
students
level.
performed poorly. So by the next exam, the result improved. Okay.
Prof. So when we come back now, we'll write exam.
Don't worry.
Thank you, Prof.
You that you are going.
Thank you.
Prof.
Thank you,
Prof. Please avoid go, sir.
Ma'am?
Yeah, the remedial exam. The remedial, sir. Is there any attachment? Is there any other fine or any additional payment for that, sir?
Is a registration.
Depend on the reason, because if you miss it because of illness, we can accept. But for those of you that are going to for exam, you have to pay for something.
Alhamdulillah.
Those that are writing exam.
Okay.
Some people are writing exam, Prof. Writing, CHO.
Oh, you are okay. You are still in okay, which means you were admitted with okay.
With you.
No, you can't be admitted except you have at times people have a degree in open university.
Yes.
Yeah.
Yes.
Because yes. So if you are there are some people like that. Okay.
Yes.
Sanjima.
So Mungode.
Say go be.
Dalorin.
Female.
Chioma.